because I'm hopeful.
Yeah, just go ahead and talk when you're ready.
Okay. All right. When you're looking at UVA and UVB, just keep in mind UVA goes right through a window, and that is causing aging and also causes melanoma. It also has like a deeper penetration. So keep that in mind. I'm telling people, I tell my patients, every single patient that I see, you should be putting sunscreen on every day if you're going to leave the house even a little bit and go into a car. Unless you were like working the night shift, then maybe not. I also wanted to point out that UVA can cause a tan. And so when you go to a tanning salon and you're gonna go and get that base tan before you make that trip to Hawaii or Florida, you are basically damaging your skin cells. And that is what a tan is. A suntan equals damaged skin cells, which is mind-blowing. For me, I always thought, oh, I might as well get a little base tan so I don't burn. And the truth is, yeah, a tan does give you an SPF of like a 4, but really you better just use sunscreen instead. So a base tan probably gives you like an SPF equivalent of an SPF 4, and that isn't good enough. And also you're damaging your skin cells when you get a tan. Also notably, a self tanner that's very common right now, like to just do a spray tan or use a spray foam or that sort of thing. It doesn't give you any ultraviolet protection. Again, it's not giving you a base tan. It's just kind of coloring your skin. But I figured I'd kind of point that out as well. So not only are we getting, sun damage through the sun, but I also wanted to make a little plug here for blue light, which comes from our screens. That also can contribute to aging as well, especially diseases where you have hyperpigmentation or skin darkening. So people with the melasma, where they have that mask of pregnancy appearance, a lot of times that is fed by blue light as well. Any questions so far? Looks like no. Got the chat here.
Oops.
Oh yeah, does sunscreen help with blue light? So actually, physical sunscreen does, which is the zinc and titanium dioxide, the physical sunscreens that go on your face all white looking, except now a lot of them have a little tint. Those protect you from blue light. So, and then they also have like blue light glasses, which I spoke to my friend who's an ophthalmologist, and she says, yeah, that is going to help protect your eyes from blue light as well, using those special blue light glasses as well. Oh, and then another good question I got here is, do your skin cells heal after burning, or is there permanent damage? So there is permanent damage from every single sunburn that you get, or even every single tan that you get. You basically accumulate, and I don't want to sound really like horrible, but it is true. We're always accruing some sort of DNA damage from ultraviolet light. And our skin, has awesome defense mechanisms, and there are like reparations that our skin and our DNA does to help, fix the problems that the sun originally caused. But it all adds up, which is why people don't really start to get skin cancer until their later years. It's really, it's not necessarily that the people in their 50s are spending a ton of time outside. It's that they spent a ton of time outside when they were younger and they're still getting sun. So the fact of the matter is, we don't ever want to get a sunburn. Sunburns are very bad, but also you don't, unfortunately, there's no healthy tan as well. And then the statistics of skin cancer is actually quite, oh, there's a question here about blue light again. How close to the screen before blue light hits you? That I actually do not know. I actually think it is close range. So if you're in front of a computer, you're up close to your phone, but you don't really get you don't get blue light from a TV screen. Does that make sense? So 1 in 5 Americans in the United States, 1 in 5 people here will develop skin cancer, but the rates in Utah are even higher. And that's for a number of different reasons, but the high altitude, the predisposition for mostly Caucasians in Utah, but 1 in 5, it's very common. So, and it's, you probably know people with skin cancer. Question about vitamin D, I will tell you about that later, Julie. So I want to briefly go over the types of skin cancer because everyone knows about melanoma. Melanoma is a killer, but that's thankfully not as common. Thankfully, it's not as common as basal cell and squamous cell carcinomas. So there's really 3 common types of skin cancers that we see. The basal cell carcinomas and squamous cell carcinomas, those are both types of skin cancers that occur from your keratinocytes. And then melanoma occurs from, it's a cancer where your melanocytes, which make your pigment, are mutated. So we'll start with the most common, which is a basal cell carcinoma. I have some pictures here of what they can look like. Sometimes they're just a little pink patch on a sun-exposed area. Often around the face, the upper back, very common. This one is directly, basal cell carcinomas are directly related to sunburns. So it would be weird if you got a basal cell where you haven't had a sunburn, but it can happen. So they come out, they can be kind of shiny and pink, like a zit that doesn't go away, or it looks like a sore that just won't heal.
So, Dr. Hadji, we do have one question over here. Would you like me to read it or can you see it?
About the vitamin D?
Yes.
Yeah. I'm going to address the vitamin D later, actually.
Okay, thank you.
Yeah, I have a slide specifically about vitamin D. Okay, so, and then squamous cell carcinomas is the second most common type of skin cancer. Squamous cell carcinomas are a little bit more dangerous than basal cell carcinomas because if you leave these ones alone, they can actually invade and spread to your lymph nodes. Squamous cell carcinomas are from people, this one is directly related to being tan. So if you're getting tan a lot, you're more likely to get a squamous cell carcinoma. So in general, people with intermittent sun get the basal cell carcinomas. The people that kind of work outside maybe, and they had summer jobs where they worked outside all summer, they're more likely to get squamous cell carcinomas. And squamous cell carcinomas are often really scaly compared to basal cells, which are like nice and smooth and like soft. Squamous cell carcinomas are hard and crusty. They look like warts a lot of times. And a lot of times squamous cell carcinomas have symptoms related to them too. They're often painful or itchy. And it's the second most common type of skin cancer. Um, this also, it's notable that squamous cell carcinoma is also can be caused by HPV or human papillomavirus, which can cause genital carcinomas as well. So people who get vulvar carcinoma, it's actually a squamous cell carcinoma directly related to HPV, the human papillomavirus. Just a little plug here about the Gardasil vaccine for kids. That actually has been decreasing squamous cell carcinoma presentations from the HPV cancer causing strains. So also, like if you have any, adolescents in your life, encourage them to get the vaccine. And then of course, I have to bring up actinic keratoses, which is probably the most common thing that I diagnose in the dermatology clinic. Actinic keratoses are pre-cancers, so they are pre-squamous cell carcinomas, and they look basically like minor squamous cell carcinomas. They're usually not as thick. They feel like sandpaper. They're red and scaly, and they show up on the face and sun exposed areas. So the dorsal arms, the back of the hands, very common for people to have some precancers there. And sometimes people say that these precancers are symptomatic too, especially like when they're putting on sunscreen, it might sting a little bit. The skin feels a little raw. And I have a ton of patients who just thought that their precancers was just dry skin. But if you're really good about moisturizing and you still have those scaly spots, maybe that's an indication that it's not just dry skin. Maybe it's a precancer. And we treat these in the dermatology clinic a lot because what we are doing is a secondary prevention. We're trying to stop those precancers from turning into a full-on squamous cell carcinoma. And we often treat them with liquid nitrogen. I mean, full disclosure, we'll just, freeze them off if there's a few of them, but there's a lot of ways that we do treat them. And then finally, the third most common type of skin cancer is melanoma. And this is the deadliest form of skin cancer. It hits young people, and it also hits our older patients too. It is most common in Caucasians, but it happens in African Americans as well, usually on their acral skin, their hands and their feet. These basically are the scariest thing that we do diagnose, but thankfully they are a lot less common. So the statistics are kind of grim. These are the most common form of cancer for young adults aged 25 to 29 years old. And so I think when I have a patient that's younger and they're just coming in for a full body skin exam, I actually really encourage people that are in their late 20s to come in and let us just take a quick look and check people's moles, because we can find them so much earlier. 1 American dies from melanoma every hour, and it is if you find it before it reaches the lymph nodes, it is really, really, really curable. It has a 98% 5-year survival rate if we just catch it early. And thankfully, the rates of melanoma detection are going up. We are finding melanomas, but thankfully we're finding them when they're early. And it's really rewarding when we can find them early. It's a little bit grimmer if we find them later. There's a few things that will actually increase your risk for melanoma pretty dramatically. And so I thought I'd go over some of the risk factors. If you have a family history of melanoma, that actually increases your risk for melanoma significantly. If you have more than 50 moles on your body, that increases your risk for melanoma. If you have large moles or atypical moles where they're not perfect circles, that increases your risk for melanoma. And then if you're a redhead as well, that can increase your risk for melanoma. We also found that patients with blue eyes and blonde hair also have an increased risk for melanoma. And I realize that's a lot of us here in Utah. Hence us having the second highest melanoma rates in the country here in Utah. Compared to the rest of the country, we have a much higher rate of melanoma. And again, there's multiple factors to this too. It is also our higher altitude, our outdoor lifestyles, a little bit of a founder effect as well with people having a long history of staying in the Salt Lake area. So when we are looking at a mole, we use the ABCDE criteria for melanoma. So A stands for asymmetry, where one half is unlike the other half. Maybe it's dark on the left side and lighter on the other side. B stands for border. Is there an irregular scalloped border or kind of a poorly defined, like smushy, smudgy border? Those are unusual and those definitely alert us. Are your moles more than two colors? Is there one where it has, you know, brown, black, white, and blue? If there's more than two colors, it does alert us. And then the diameter is also really important. We use the 6 millimeter criteria. So 6 millimeters is basically larger than the size of a pencil eraser. So we look at these moles. A lot of people have big moles, and that alone is not, you know, a reason to biopsy a mole. But are the other criteria also being hit with this? And then evolving is a big one too. That's the E of the ABCDEs. Are any of the moles changing? Are they changing in size, shape, or color? So I have a question here from Erin. Yeah, I find that I find that primary care doctors are overwhelmed already with health issues. A lot of times, they're just not trained to look at the skin. It's true that in medical school, you know, before my residency, dermatology was covered in 3 days, and that's pretty standard for all dermatologists, or I mean all MDs and DOs. They pretty much have that amount of training in medical school. So I think you know, the American Academy of Dermatology does a lot of these spot skin cancer treatment or screenings in May, and we try to have exposure to that. But honestly, I think if you are meeting these criteria, you should just see a dermatologist. Because I don't think that there's no such thing as like a bad consult. At least I could you know, look at your skin and then just say, yeah, you probably don't need to come in every year. You can come in every 2 years or every 3 years. based on what I see. So when we find a melanoma, we try to find it early, of course. And so we will do biopsies, and we try to get the whole lesion with the biopsy. We try not to sample things. So we try not to take just part of the melanoma, because the entire lesion is going to tell us how we are going to treat this. If it's going very deep, then it's going to require more than just a surgical treatment where we only do an excision. Patients might actually need scans to see if they have any lymph node involvement. We actually do sentinel lymph node biopsies. And then we also do chemotherapy and immunotherapy for our later stage melanoma patients. And it's actually pretty amazing. Even our later stage melanoma patients have had a massive increase in survival because of the newer immunotherapy medications. And we're really lucky to have, amazing surgical oncologists here in the state of Utah, in the Salt Lake Valley. The Huntsman Cancer Institute has outstanding immunotherapy protocols. So my patients are surviving. And a question here is, if you have cancers burned off, are you more likely to get cancer easier? So if you have had a precancer, or you've had the scrape and burn procedure where you've already had a basal cell or squamous cell carcinoma, your risk for having a second or third skin cancer is higher. And you are technically at a higher risk of developing the other types of skin cancer, because it's all related to ultraviolet damage. So I think it's really important that I kind of mention here, screen yourself and screen the people that you love. And there are a lot of how-tos on how to do your own skin exam. And we definitely don't do this enough. We need to look at ourselves in the mirror without our clothes on, and we need to be comfortable and aware of all of our moles, even in the nooks and crannies. So the American Academy of Dermatology has this awesome infographic on how to do your own skin exam. But essentially, you need to stand in front of a mirror, use a handheld mirror as well to help see the areas that you can't see alone. Look in between your toes, the bottoms of your feet, even in areas where you don't necessarily think that you've gotten any sun. You'll want to look you want to kind of feel around on your scalp for any lumps or bumps, and then check your genitals and your back and your buttocks as well. So sunscreen is really a wonderful answer, but that's not the only thing that we should do to protect ourselves from the sun. But let me talk to you a little bit about sunscreen. All sunscreens here in the United States are broad spectrum, and what you need to reach for is something that's SPF 30 or greater. And I think an SPF 30 or greater is perfect for everyday use too on your face. It really matters what your activity is when you look at the water resistance. So I'd love to be like, okay, just use, this fancy face sunscreen all over your body. But the truth is, a lot of the fancy face sunscreens that I like to use on a daily basis have zero water resistance. And so if I'm going to be out hiking and I'm going to be breaking a big sweat, I'm going to be like wiping my face and wiping the sweat away, I need to get something that's very water resistant. And the other thing that I want to tell you is that you should use a lot of sunscreen. Actually, when you're wearing like shorts and a t-shirt, you need about an ounce to even 2 ounces of sunscreen based on the average adult. So probably people are not using enough sunscreen when they are applying sunscreen as well. And then you also need to make sure that you're reapplying sunscreen every hour if you're active, or every 2 hours if you're just chilling outside. So that's another thing where people literally get burned. They put on their sunscreen at the beginning of the day, they went a little longer without reapplying their sunscreen. And then a big pet peeve of mine is when I see people use spray sunscreens, they don't rub them in. You need to rub in your spray sunscreens. You need to rub them in because you need to have good skin contact for those to work. And you're supposed to apply your sunscreens 15 minutes before going out and getting the sun exposure. There are so many good sunscreens out there, and I totally understand what you're asking me about. The question is there a good sunscreen that is not greasy and sticky that you don't notice that you have on? Well, the truth is, yes, if you are using sunscreen that is not water resistant. A lot of the water resistant sunscreens, and you have to use those if you're going to be outside and you're going to be active, you need to use the kind of the stickier ones like the sticks, or the sunscreens that have water resistance. But if you're using a sunscreen every day just because you're driving and you just want to decrease your ultraviolet radiation that you're just getting exposed to on a daily basis, or if you're just taking a leisurely walk at the end of the day, your 5 p.m. end of the day walk, and you just want to put on some sunscreen, you can just use a physical sunscreen. And physical sunscreens are often a lot less sticky, and they often have they're often very elegant. So some of the best ones, I'm just gonna like write them down. I really like the Abcde that has zinc in it. It's the UV facial. Everyone really likes this one, and it's pretty good for sensitive skin. And then I really like the La Roche-Posay brand too. They have like a really good melt-in milk type of sunscreen that's also very light and doesn't go on very greasy. So when I look at sunscreens, I basically categorize them as, are they physical? Are they just zinc and titanium? Or are they chemical? Or are they a hybrid? So a lot of sunscreens will have a little bit of zinc and then also a combination of the chemical sunscreens. And the chemical sunscreens, they've gotten a bad rap because of the whole Hawaii reef ban. Of note, you can still buy those sunscreens in Hawaii, by the way. They still sell them. They just don't want you to use them in the ocean when you're like snorkeling. They want you to use the physical sunscreens. The chemical sunscreens in general, they don't leave a residue. They don't leave like a zinc hue where you look like Casper the Ghost. So they're often preferable for most people, especially if you have facial hair. You probably don't want to make your beard look all whitish looking. So I would probably just stick with the chemical sunscreens for those people. If you're a baby or you have rosacea or sensitive skin, then you should only be using physical sunscreen, I think, because a lot of people end up developing allergies or sensitivities to the chemicals. But sunscreen is not enough, right? I don't think we should be like getting exposed in the middle of the day if we can help it. We should be avoiding the sun during the peak hours of light, which is basically from 10 a.m. to 3 p.m. I just stay inside, or if you have to be outside, make sure you're wearing long sleeves, you're wearing a hat, and you're staying in the shade. It's not done enough, unfortunately. I think, you know, when I go to Hawaii and I'm enjoying like a nice pool vacation, I do go swimming in the middle of the day, but I have long sleeves on when I'm in the pool. And then when I'm out of the pool, I go directly into the shade. And the biggest thing I think for preventing skin cancer is stopping our exposures to ultraviolet light. That's the main thing that's driving this is ultraviolet radiation causes direct DNA damage, which causes skin cancer. And so now I wanted to talk about vitamin D because a lot of us are low on vitamin D, especially those of us who have very, very pale skin and can't go outside because they burn immediately. So my patients who are basically extremely white, or also my patients who are extremely dark skinned as well, those patients are often low on vitamin D. But I'd recommend that you get vitamin D through diet. And so with the diet, you can find vitamin D in fortified milk, cheeses, and yogurt, and fortified cereal. Funnily enough, your orange juice might have some vitamin D in it. Oily fish, vitamin D is naturally found in oily fish like salmon and tuna. And then supplements as well. I have a gummy vitamin D every day, and it's delicious, and I look forward to it every day. And I recommend that if you're not the extreme white or the extreme dark skinned person, that you just take a multivitamin with vitamin D. For the other patients who have extremely light skin or extremely dark skin, you should actually see a physician about how to best supplement your diet. You might actually require more international units than the average bear. And do not go out and intentionally get vitamin D by just going outside and like sun tanning. It's great to be outside. I moved to Utah to be a hiker and biker and skier and to be outside. And it's wonderful to do that, but I'm getting my vitamin D just by being outside and wearing my sunscreen and still getting a small amount of sunscreen or sun naturally. And now I think I've covered most of the things I wanted to cover, but I bet there are some questions. How much do clouds protect from the sun's rays? Actually, not very much at all. So, when we look at like how much is like actually being filtered out there, you can think of it as like an SPF of 2. You can still get a great burn on a cloudy day. Do I think that UPF shirts are worth buying, or is a regular long sleeve shirt good enough? I think UPF 50 rating really matters, but I'll tell you what. We found that a long white sleeve or a long white cotton t-shirt is only an SPF 4. And you can often tell like how much of a UPF is it just by holding the fabric up to the light. If you can see through it pretty easily, then you're not getting any protection. Someone told you that inhaling the aerosol sunscreen has been linked to colon cancer due to inhaling the chemicals. So they actually found that recently a bunch of the spray chemical sunscreens had benzene in it, which is a known carcinogen. So they found it across the board in like all the brands. Like it was in the UltimD brand, it was also in the Neutrogena brand, and it was a trace amount of benzene I don't recommend, I always recommend that if you're going to use a spray sunscreen, use it in a well ventilated area. Don't use it on kids. Make sure you rub it in. And I don't think, I think the spray sunscreen really should be used for areas like the scalp where you have a lot of hair, and you can't get good coverage elsewhere with like a cream. And then the question about recent news that chemical sunscreens might actually cause fertility problems in cancer. So avobenzone and oxybenzone have actually not been linked. The most common chemical sunscreens have not been linked to any fertility issues or to cancer. They did find, though, this is the interesting thing, they did find that you are absorbing, if you put it all over your body, the chemical sunscreens, you are actually absorbing it in your bloodstream. And they have never done studies to see, well, what does that mean? Like, what if there is some trace amount of avobenzone going in my bloodstream? But it has never been linked to cancer. I think that's a misinformation. Question about the lips. I use an SPF 30 lip balm. I use like the Sun Bum chemical one. And it tastes disgusting, but it works. So are people of color needing to follow the same recommendations? Are their skin cancer risks the same? Their skin cancer risk is lower than a Caucasian. However, they are still getting aging through the ultraviolet light, and they are also at risk of getting skin cancer too. So I have diagnosed basal cell, squamous cell carcinomas, and melanomas in patients of color. It is rarer, but I still would recommend that they follow those recommendations. Do you think, did I answer everyone's question? That was, oh, there was something about a vitamin D light, like that you can buy. I have never done any, I haven't done research on that, unfortunately. So I'm not sure. It's called the Spurdy Vitamin D light. And I haven't done research specifically on that, so I'm not sure. Are there any other questions?
Dr. Haji, that was amazing. Thank you so much. I always learn something new. When I saw you about a week ago, did you say something about vitamin B also helping with skin?
Oh, I did. So, I decided not to include that in my presentation because I wanted people to check with their primary care doctors about this. But niacinamide supplementation has actually been proven to decrease your risk for actinic keratoses, squamous cell carcinomas, basal cell carcinomas, not melanoma. Niacinamide is a vitamin B, and it's basically also an antioxidant, so it decreases your free radical formation when you're exposed to ultraviolet light. And I, if you wanted to start doing that, like if you're a high risk patient, you already have a history of pre-cancers, you've already had things burned off, I would talk to either your dermatologist or your primary care doctor about doing niacinamide supplementation. The problem with niacinamide, though, is it can interact with some medications. Like it can interact with your cholesterol medications, some blood pressure medications. So it's weird. Supplements can be wonderful, but they also can cause harm. So if you're not taking anything, why not? Take some niacinamide. You're supposed to take 500 milligrams twice a day. And then for vitamin B complex, I don't know if a vitamin B complex is going to have that much niacinamide in it. And then a question about are chemical peels harmful? In general, they are not harmful. They can be overdone. Some people can go a little overzealous, but no, I use chemical peels all the time in my clinic. Anything else?
It looks like that's about it for all the questions, Dr. Hadji. Thank you
Awesome.
so much. If anybody has any other questions, you're more than welcome to send them to either Sadie or Hala, and I will get them to Dr. Hadji. Again, everybody have a good and safe summer. Thanks, Dr. Hadji. We'll talk to you soon.
Okay, thank you.
Thank you so much.